in this country. We have the most expensive healthcare system in the world, and we have some of the poorest results. Health Guardians is a program in Catholic Charities that helps people who have chronic illnesses get quality care. Whatever it takes to get you good care, that's what we will do. That's our strategy.
We're trying to catch the people that have fallen through the cracks of the healthcare system, the people that no other agency in the city has been able to help. In the healthcare system, 50% of the spending is done by the top 5% of super utilizers.
We focus on this population. They're going to the emergency room unnecessarily. That's expensive care. And we have some people that have made as many as 50 or 60 trips a year. When the hospital is bleeding cash in the emergency room, that's going to get transferred to payers. Whether you pay directly, or you pay through taxes, or you pay your health premium. That emergency room is costing money. So if we could run it more efficiently, we could bring down the costs, increase the value, and spread access. Health Guardians Catholic Charities is unique because it's not just a medical program, but it takes into account all the social determinants of health. It's important to understand why these people are going to the emergency room.
They may have problems with transportation, unable to get to their doctor's appointments. They may have to choose whether I pay my utility bill versus buying my insulin. And so we sit down with them and we figure out what are your needs, what are your barriers, how can we help you?
Everything that has an outcome or an influence on the person's health is taken care of, whether it be medicine, a doctor visit, an air conditioner for asthma.
We do a home visit and we find someone doesn't have a working refrigerator and they take insulin for their diabetes, and we're able to buy them a mini fridge to refrigerate their insulin. And it's examples like these that are so simple and common sense and practical that the healthcare system has forgotten.
Being able to provide a full circle, wrap-around, holistic approach to case management, we get better results with that. Jonathan and Kay Velko, basically they were homeless and had a wealth of chronic conditions.
I was having shortness of breath, which I thought I just needed a breathing treatment or medicine. It wasn't until I went to the ER, they told me my left lung, the only good lung I had, collapsed and punctured.
Miss Paula and I, were discussing it, and she said that there was an apartment complex that we could go to so that he didn't have to recuperate in the shelter. And that's how we ended up here.
The essential thing was housing. And from there, connecting them to specialty care services. Now I see them, they've made a tremendous change.
Had it not been for the program, my medical condition wouldn't have improved. Kay's medical situation would have improved.
If it wasn't for Health Guardians, we really don't know where we'd be.
Once we graduate them, these interventions are sustained. They don't want to rely on services that we're providing long term. That is rewarding for me. That makes me feel like my purpose as a patient navigator has been fulfilled.
The client is healthier, feels better. And then at the end of the day, we've taken the burden off the system, so there's a significant economic impact. We have very good data on pre-enrollment into Health Guardians, during enrollment, and 6 months after discharge, and that's a significant drop in spending.
For each patient that comes into our program now, we're showing a cost savings of $23,000. So you take the hundreds of patients that have come through our program and are yet to come through our program, and you're looking at millions of dollars in cost savings for the system and helping the most vulnerable in the most personalized way possible. That's why we really believe in this program.